Babies love exploring, but their little fingers and hands can easily get stuck in small spaces. Sometimes they may get hand or finger injuries, such as bruises, cuts or fractures, or they may hurt or sprain their arm or wrist. In the following steps we'll cover hand and finger injuries, then we'll cover forearm and wrist injuries. If your baby has trapped their hands or fingers, these are the things to look for. They may find it hard to move their hand or wrist. They may feel pain in the area. The hand or wrist may be tender and there may be swelling or bruising. If you think your baby has a hand or finger injury, take the following steps. Sit or lie your baby down and try to raise and support the affected wrist and hand. If there is any bleeding, run the cut under cold water first, then loosely cover the wound with a new sterile dressing or large, clean, non-fluffy pad. Call your doctor or see a nurse, especially if your baby's fingernail has been injured or you think there may be a fracture, a broken bone. If your baby is in a lot of pain, you can try treating them with the recommended dose of paracetamol. Now we're going to move on to wrist and forearm injuries. If your baby has injured their wrist or forearm, these are the things to look for. The area may be tender and there may be swelling or bruising and they may feel pain in the area. It can be difficult to know if your baby has a sprain or a fracture, but if you think your baby has a wrist or forearm injury, take the following steps. Remember, RICE. Rest. Help your baby to sit or lie down and support their arm in a comfortable raised position. Ice. Apply something as cold as your baby can bear. This could be a cold flannel, an ice pack or frozen peas wrapped in a cloth. Leave the ice pack in place for no longer than 10 minutes. Comfortable support. You could wrap a soft layer of padding like cotton wool around the area. And elevation. Keep your baby's arm raised with something soft like cushions or a rolled up blanket. Call your doctor or see a nurse if your baby is in severe pain or they can't use their hand or wrist at all. If your baby is in a lot of pain, you can try treating them with the recommended dose of paracetamol. So remember, for hand or finger injuries, sit or lie your baby down and raise the injured hand. Wash any cuts and cover the wound with a non-fluffy dressing. Pad the hand with something soft. Call your doctor if you have any concerns. For severe pain, you can give the recommended dose of paracetamol. For wrist and forearm injuries, remember RICE. Sit or lie your baby down and raise the injured arm. Apply ice. Support the arm and keep the arm raised. Again, call your doctors if you have any concerns. For severe pain, you can give the recommended dose of paracetamol. And that's how you treat a baby who has hurt their hands or their arms. Thanks for watching. Help support St John Ambulance. Donate today.